Ngisahlezi nathi kanti ke le i-Daily Theta siqhubekela phambili ngeinkulumo ezibalekile ukuthi kungani kushoda odokotela kangaka yize bafundile bagogoda kodwa bakwazi ukuthi bathole imisebenzi. Joining us for this conversation via Zoom now is Dr. Akhtar Hussain, who's a SAMA board member. Thank you so much for your time, Dr. Hussain. If you caught parts of the conversations that we just had now between the Department of Health as well as SAMATU, what is your immediate response to what we've just heard right now on the program, and what do you think the actual problem is here?
Thank you very much for the SABC1 listener. Greeting to all. On behalf of South African Medical Association, SAMA has been raising the same issue last 10 to 15 years. Department of Health, either is a provincial department or is a district health or is a national health service. They are collapsed, they are collapsing, nothing improved. Now I hear that doctors don't want to go for rural health service. Who is running the rural health service? Is the community health doctors, community health service doctors, the interns. In fact, most of the rural hospitals, there are no senior doctors, no consultant, no specialist. The community health doctors are running the hospital, not only the clinical service. On the top, when they finish community health service, they don't get post. The posts are not advertised. They are not retention policy, Department of Health. The policy is there, but the implementation, their slogan is quality health service in public sector. If you come to the clinic, any clinic in South Africa, you have to come 4 o'clock morning to see a doctor. And that doctor alone seeing 100 patients. Is it a quality care? Is it a quality service? They don't want to appoint. If I resign today from the public sector hospital, that post will be showing 0 vacancy. They're not going to advertise. The issue is here. We have been discussing this years and years, many years with the minister to the different provincial level. They got a clear instruction, cost cutting. Reduce budget, save money, do other things. You know, the infrastructures are rotten, falling down. Instruments are broken. Theaters are not functioning. So now they don't want to appoint junior doctor. We did a survey. So SAMA did a survey recently. Most of the young doctors are sitting at home. Even the junior specialists don't have a post. We are not training enough registrar to become a specialist and give the specialist care to the community. So ultimately, by cutting costs, not advertising posts, and saying lame excuse that doctors don't want to go to the rural hospital, that is not true, because 2,500 community service, 2,500 and 3,000 interns, where they are working? They are not all working in Baragwana or King Edward or Albert Lutuli Central Hospital. They are working in regional hospital, district hospital, periphery hospital. All right. So why they are not going to go there? This is not acceptable. On the top, the doctor's remuneration is not done last 15 years. We are not asking to increase the salary, but there are no incentive to go to rural hospital. There is no accommodation. In one room, 4 interns staying. There is no kitchen, no shopping center around to buy the food. How you expect a family junior doctor to stay in a remote area and can't have any accessibility, and even they can't even go to the bank. Roads are broken. They don't have enough transport system.
Yes.
So I don't understand blaming doctor not going to the rural hospital. That is not true.
Dr. Hussain, so I understand that you also had some engagements with the Department of Health. Perhaps just let us know about some of the solutions or what you guys proposed in order to ease the plight of these unemployed doctors.
Well, we have given all the proposal to retain, especially the junior doctors. They are not interested to in private sector. Their government need to increase the funding, and that funding, the corruption must go so they can advertise those posts and appoint junior doctors. Now, 5 years ago and now, the minimum critical level of staffing of doctors is low. If there was a 20 doctor serving one hospital, now it's about 8 or 9 doctors working. So it's just the double the workload for our doctors. So where are those 10 posts gone? So they have to reopen those. If you're asking budget, they're blaming the treasury blaming the Department of Health. They say there's no moratorium in health sector, especially appointing doctors. So those things need to be clear. They need to have a clear short-term, long-term policy implementation. Policies are there are no implementation. So like Gauteng Health Department recently mentioned that junior doctor can go work in a private sector, or who is going to supervise the intern and com service in a private hospital? They're going to be abused. Our junior doctor cannot go and work without supervision. As it is, even public sector, there are not enough senior doctors. They don't get supervised. There's no accountability. We need transparency by Department of Health. We are the health stakeholder.
Okay.
On the top, there's no safety and security.
Okay. All right, Dr. Hussain there. Mbukelo we Daily Theta uMasibuya siqhubekela phambili ngale nkulumo yethu. Hlala nathi khona la ku Daily Theta.
Go dula o sa bereke se doctor o tshaba le go fa bana motivation, o tshaba le go like apo ka se kgopelo like o tletse botsholo wa no batho ba kgopela wena thusho and all that. So the changes tsela gore nka di rata gore di ka direga ke gore like maybe go ne le honesty mo Department of Health. I think there's something's lacking. Something should be done where ska ba re fa di false hopes, and then bana gane gore batho ba re bitsang for the interview dipetlele tsona tseo bana no ba tsebo gore okay sometimes if it's gore maybe ke go Limpopo and then I'm being called for interview go Western Cape because I'm looking for a job. I go there and I applied for it, and maybe ke department e ke ratang then, so I'll go for it. I'll do all the means ke kope chelete for petrol, for dijo, everything, because I cannot sell. Then ke go Western Cape. So ke sa matsapa that effort ya go Western Cape ja go ira interview fair, and then ba mpotsa we're gonna get back to you, and they never get back to you. I'm not gonna lie, the doctors are not valued at all, because even when employed, even those ones that they're employed, they are not really valued. I think the way in which badirang ba SAMATU for the interview, which can change, and then at least if you ever face the interview, at least ba go fet closure, like gone the closure gore ba go bolela okay, this is the memorandum, and then on wa rabile so na ba tedi karabo tse di so wena o grele 2 out of 50, so then you can have close, you know what, okay ke reports amol. At least there was one where he applied family medicine post register post ko Rahima Musa, then at least they gave me the to say, you know what, it was not successful because of this and this and this, not generalizing. It was a good thing. I think it was a good thing that, you know what, that doctor's like, you know what, usually what wrong you doing, how to apply and all that. But the reason we're not being shortlisted is can be this, can be that. We're just generalizing. In general, this is the mistake that you do. So at least we could pick it up there.
Man, it's no secret Tugutu, we have a very passionate generation, a generation that is willing to lend a hand and also work. Godoge, there are also a lot of stumbling blocks. Sifike maphethelweni wenkulumo yethu around our doctors are unemployed. Khona la ku Daily Theta. Dr. Hussain, I'm going to ask you to quickly give us your parting shot as we wrap up this conversation here on the program today. How do we really find a silver lining in all of this?
Yeah, there are no issue. The Department of Health must advertise those posts, not tomorrow. Today, immediately, if they're saying there is a post in rural health or anywhere, they must advertise, because in their system, they're showing 0 vacancy. That tricks, they must come out, because they're deceiving our doctors that there are no posts. There are posts, but they are deleting those posts. So Department of Health whether it's a provincial or national, must advertise and according to the organogram, minimum number of doctors must be appointed. There are no negotiation on a doctor shortage. There are doctors, they need to appoint them because at the moment doctors are overworked, overburdened, and doing 3 or 4 doctor job, 1 doctor.
All right, Dr. Akhtar Hussain is a South African Medical Association board member. Thanks very much indeed for your time on the program. Dr. Sihlangu, yazi from Inkulumo Yethu namhlanje, listen.